Thank you very much, Christina, and it's a pleasure to be here. We have seen earlier that the subject of urban health is an important one, and actually urban health is everything, as Priya said earlier, because she said urban is a microcosm of global. So it's a pleasure to look at this further in this session today. Urban health emerged over recent years as a transdisciplinary and interdisciplinary subject. We at the Hub are, of course, very proud to enable such cross-cutting discussions in our Hub communities, which are an ideal platform to bring together different stakeholders in a non-hierarchical and multi-stakeholder way, as you all have seen, hopefully, during the course of this conference. The Hub Community on Global Urban Health recently published a policy brief, which is also outside, which was one of the Hub's most favorite publications. And in the paper, the Hub Community argues that cities can become drivers for health through promoting healthy lifestyles and health equity. In fact, they argue that the current trend of urban transformation in low and middle income countries can be a huge opportunity for global health. Today, we want to share the findings of the paper and discuss the challenges and the potential of urban health in low and middle income countries in particular with our distinguished international guests. We will start with a quick overview of the main recommendations of the paper, and then we're eager, of course, to hear the voices of our international panelists. Carsten, Dr. Carsten Butsch here, has been leading the community for the past 2 years together with Timo Falkenberg, who unfortunately is no longer here today. But of course, this is not your full-time job. He's also a senior researcher at the Department of Geography of the University of Bonn. Also with us from Singapore and India is Dr. Priya Balasubramaniam, who's a senior public health scientist at the Public Health Foundation of India and also the director at the Center for Sustainable Health Innovations in Singapore. And she, over the past 20 years, has been shaping health system capacity and research in South and Southeast Asia, East Africa, the United States, and Canada. Dr. Carlos Dora, who's also with us online, welcome Carlos, is the president of the International Society for Urban Health. Carlos is a medical doctor and a health, environment and public policies expert. He recently led the WHO's work on health impacts of sector policies, where he also developed a new urban health initiative, and he emphasized in our earlier talk that urbanists and public health actors need to work together on this subject of urban health. Jill Penalosa is the founder and chair of 880 Cities and the founder and lead of Cities for Everyone. His motto is, if cities are healthy for an 8-year-old and an 80-year-old, then they are healthy for everyone. He is from Bogota, has given advice to over 350 cities, lived in Canada for the past 20 years, and today, if I'm correct, Jill, you're with us live from Buenos Aires. Welcome to the session. First of all, I would like to ask Carsten to give us a brief overview on the findings and recommendations of the paper of the Hub Community.
Okay, yeah, thank you, Merle, very much for this introduction. I hope it's okay if I stand up, but I can't present when I'm sitting, sorry. I'm a university teacher, and sitting and lecturing doesn't work together for me well. First of all, I'm very happy that Priya is here, and Carlos and Jill. So for you all, this is not very new, but I'm very happy that you help us to make us a point here. So when we wrote the policy brief, we actually had the idea that it would be 2 or 4 A4 pages, so that you could fold it up, so that it would be really brief and the essentials would be there on 4 pages with one central graph in the middle. We've been working on that policy brief for almost 1.5 years, and it didn't work out, so it's much longer. But you get the information in a nutshell in the next 5 minutes. So why is it very important to talk about urban health? What is the context of urban health as we see it? On the one hand, it's interesting to see that living in a city can be positive or negative, or if you look at the literature, we find on the one hand an urban advantage or an urban penalty. So for some people, it's healthier to live in the city than in a rural area. For others, it's not. So for example, if you look at the lower 20% of income, you see, for example, higher infant mortality and things like that. And what does it depend on, whether you have or whether you experience an urban advantage or an urban penalty? It depends on your socioeconomic status, your age, and your gender. So what are the burdens that we find in cities? Very generally, you have crowding, you have noise, you have pollutants, you have the stress of urban life, you have sometimes even lack to healthy foods, so we would call that food deserts. But there are also a lot of chances. So we have, for example, the best healthcare facilities usually available in cities. We have cultural services, we have strong social networks, we have sometimes more effective wash services, not for all again. And globally, and this is, I think, the important point why it's really important to think about cities. Cities are the dominant habitat of humanity in the 21st century. So human health will be urban health. And this morning, we heard that in Frankfurt, only 1% of the city is still to be built. This figure is much different on what we focus today's discussion. In the Global South, for example, between now and 2050, 400 additional people, for example, live in Indian cities alone. 400 million people for which urban space has to be built. And the question how we build this space will be decisive for global health. Okay, what are the key messages of our policy brief? So the first thing is we actually need a city diagnosis. So we need for each individual city to understand which specific health problems are there. We have the ultimate goal, which is up here, which is a healthy city. But we have different departuring points. And each city needs to find its individual way there. But for that, we need an individual diagnosis. The second point is we need to treat urban health as an integrated approach. So urban governments have to come together and talk. It's not about only the health departments, but it's the planning departments, it's the solid waste departments, it's the education departments, you name it. They all have to make health a priority and think about what their action actually means for health. And the last one is we need a health-promoting urban development, especially in the Global South, because the growth of cities in the Global South is at the moment, it's a window of opportunity. So we now can shape the structures of the future. So if we can transform cities, they can be spaces of opportunity for health and not spaces of ill health. We try to bring the factors which affect urban health together in this graph, which we see as a kind of centerpiece. And probably you cannot grasp it in its complexity in the next few minutes, but you can download the policy brief and study it. We hope that you will study it, use it, share it, use it for discussions. And just to guide you through briefly, we're in the middle of this presentation or this slide, we have the neighborhoods. They are actually the essential settings where health is shaped. But these neighborhoods are actually affected by factors on different layers, which are there on the macro level, which is a global dimension. We have the meso level, which could be, for example, the national level, and then we have the local level. And all that then affects the individual neighborhoods which are nested in the city. And these different factors actually mediate through the different scales that we have. And for example, climate change is something we discussed this morning. If you look at climate change, which is a global phenomenon, it will affect agriculture, the production of food, it will affect our health systems because we will see, for example, new health problems. But on the local level, it will affect the wash infrastructure because we might have less water. It will affect the green and blue spaces, which we need more, but which may be also affected by changing climate. We see the local food system, which is maybe troubled by climate change and the agricultural production, and of course the urban climate itself. If you look at, for example, processes like migration, that will affect the health systems because migrants will put additional pressure on local healthcare systems. But migrants will also bring their own concepts and beliefs of health, which may not be compatible with the health systems we have. So on the local level, that will affect, for example, the number and distribution of healthcare providers, we would have to look at this in municipal health reporting, but it will also affect, for example, segregation tendencies if we do not have proper integration measures, which will in fact have an impact on health. These are just two examples how you can follow larger processes, how they actually trickle down on the local sphere. So having said this, we have a couple of core recommendations, not all of that are on that slide, but these are, I feel, the most important ones which address different stakeholders. For municipal authorities, we think it's really important that health becomes an intersectoral concern, and we think that for new projects, we would need something like a health impact assessment. The second thing is, and this is something we may overlook sometimes, the civil society is very important in promoting health. For example, if you look at sports clubs or something, they do a lot of free work for promoting health, and so they are really important partners for prevention. It's really important to keep them on board. For the economy, again, there's a lot of things to say. For example, if you look at the private developers, which are actually making in the global south of cities, they actually have a very high responsibility. But here I just took as two recommendations out of a bunch. They are also responsible for creating healthy work environments and reduce the environmental pollutions, which we find especially in many cities of the global south. National governments need to enable local governments to promote health. They need finance, they need knowledge, and things like that. We would actually like to see more collaboration on between international organizations on the topic of urban health. There's a collaboration going on between WHO and Habitat, and we think this really needs to be deepened. And as I said, I'm a university teacher and researcher. I think we also would need much more funds for truly transdisciplinary research. And by transdisciplinary research, I mean that different disciplines have to come together and they really have to cooperate with people, practitioners on the ground. That's for me transdisciplinary research. So these are our findings, and I'm looking forward to discussing this with our international colleagues.
Thank you so much, Carsten, for presenting these insights. And again, the paper is on the Global Health Hub website and also outside for you to get a copy of. Priya, to set the scene, can you give us an example of what urban transformation looks like in Southeast Asia?
Thank you so much. I'd like to, on the outset, thank the Global Health Hub and Carsten and colleagues for inviting me here to be part of this really exciting forum and discussion. It's an interesting question, and I'm trying to see how best to phrase an answer that's broad enough. I had the privilege in a post-COVID world to travel here, and before I traveled, I was in two other cities. I was in Jakarta, with a population of 11.8 million. Then I was in Mumbai with a population of 18.7 million. Singapore, population of 5 million, and Berlin with a population of 3.6 million. So cities are here to stay. They will continue their growth trajectory any which way we see it. But one thing as I was kind of moving through these cities is that each one had such a distinct DNA. In many ways, cities are organic. They are agglomerations of people. They are an agglomeration of spaces, and they're an agglomeration of capital. And at the end of the day, it's the ability to manage these three things that has huge impact on both our health as well as economic growth. So having said that, I do feel that urban is a social determinant of health. It is a commercial determinant of health, as well as increasingly a political determinant of health. COVID-19, I think, has dramatically influenced trends. It has been characterized as a syndemic, where it plays on underlying health conditions. And that has had a huge implication of how cities are being viewed as nexuses between health systems. There are three things that I think urban trends in Asia have touched upon, four actually. The first one is around innovation and digital disruption. Stemming from COVID, there has been a tremendous amount of innovation in urban health spaces, both in terms of access and delivery. And a lot of this has actually disrupted the way healthcare is being accessed, data is being surveyed in cities where traditional data collection was highly fragmented. It has highlighted the role of community like never before. In previously isolated spaces within urban environments, the role of the community has played a forefront, not only during the pandemic, but even beyond it. This has been demonstrated in many cities, whether it is the heat action plan that was started in Ahmedabad in 2010, and it actually kind of rolled into a community-based initiative where it ended up being absorbed and implemented by many other states and municipal corporations in India. Then it also highlighted the role of partnerships. And here you have the government sector, the private sector, and the people sector. And this is another area where cities are transforming the way health partnerships are happening, whether they are partnerships with digital providers, partnerships with the private sector. These are new kinds of partnerships that are going to influence the way cities are going to finance healthcare in the future, because most cities in the global south have pluralistic health systems, and there will be blended models of financing and care delivery that are going to set the tone going forward. And last but not the least, there has been a distinct shift in urban governance itself. Municipal governments, which were largely operating under a colonial framework with a lot of investment on infrastructure and urban capital works and so on, have gone through a big rethink. They've gone through a rethink because now they realize that communities and civil society form a huge part of urban response. And in that sense, there has been a tremendous shift in the way they have also thought about informal economies that make up most cities. 81 million people in Asia live in informal settlements. There has also been the use of digital and technologies in the way local governments have actually engaged with the society. So there have been improved standards, there have been good governance frameworks that they've tried to apply, and they've tried to do this with digital and technology. So these are the 5 broad areas where I see urban trends emerging, and I'll stop over there.
Thank you so much, Priya. And one of the key messages, as you heard from Carsten of the paper, is that the urban transformation in the global south is a window of opportunity for urban health. Jill, could you briefly explain how this relates to your experiences in Bogota?
Well, thank you very much. I think that it's very important to realize that today we have about 3.5 billion people living in an urban area. Are you getting an echo? Do you hear fine?
We hear a bit of an echo, but I think we keep going, Jill.
So
yeah?
Okay, can you hear me? Is this better?
Maybe to mute some of the other
Today we have about
microphones.
3.5 billion people living in cities. In 40 years, we are going to have about 7 billion. That means that half of the homes that will be around in 40 years do not exist today. This is, like Carsten says, an opportunity, but also a huge responsibility, because whatever we do or don't do is where billions and billions of people are going to live for hundreds and hundreds of years. And also we need to realize, if that is going to happen in the next 40 years, what have we done in the last 40? The reality is that in the last 40, the overwhelming majority of what we have done in cities is bad. Much of it is terrible. Very few exceptions, like with acupuncture. Why do I mean bad? Because it's bad. The urban areas are bad for mental health, for physical health, for climate change, and so on. So when we talk about Carsten's urban health, sociability, nature, and the built environment, we need to do it radically different. We have a huge opportunity. In the case of Bogota, before I moved to Toronto, I led the construction of over 200 parks all over the city, small, medium, large, especially in low-income areas. In low-income areas, it's very important because when the poor people feel miserable, it's in the leisure time. So low-income areas have to have much better public everything, public parks, public sidewalks, public bike lanes, public schools, public everything has to be better. I also found a small program called Ciclovia, which in many other areas we call it open streets, that on Sundays we open streets to people and close them to cars. It was less than 20 kilometers, and I took it to 121 kilometers. We get over 1 million people out. And this is good because this is about physical health and mental health, and it's about social integration, and it's about meeting each other as equals. And also this is good anywhere. All you really need is streets and people, and every city has streets and people, and it works in cities of 100,000, of 1 million, of 10 million. So I think that was also an experience that also has been all over the place. I have worked in over 350 cities, and I always mention Ciclovia or open streets because it's easily doable. It's not a technical issue, it's not a financial issue, it's a political, and it has multiple benefits. And we have worked measuring, for example, health. We measure on Sunday at noon the quality of the air, and then in the same places on Monday at noon, the level of noise on Sunday and the level of noise on Monday. So it also provides very clear, very easy benchmarks to see what it happens when when we're not building the city for the car, but we're building it for people.
Thank you, Jill. And I think, yes, it's a huge responsibility, but it's not always that easy. So, Carlos, from your experiences, what are the biggest barriers for urban health in the Global South?
Well, first of all, thank you for the invitation. Congratulations, Germany Global Health Hub, to focus on cities. I think is is a very good initiative and is very necessary. I think the barriers, if we just think of when Healthy Cities came about, this was the 1980s. So we do have excellent ideas about how to go about building health in cities, bringing health promotion together, working with public policies. And I think that's the demonstration that that can work is out there, is present, so we don't have a problem with what is it that we should be doing. I think the paper, the policy brief, what proposed to develop the vision is one of the things which is important, one of the mechanisms to how do we build that. But in reality, so I think the difficulty is making that aspiration and that understanding of the links between the different sectors and health, of the activities between urban planning, as Jill was saying, access to food, to sustainable transport, the mediators, quality of air, etc. I think the biggest difficulty is actually making that transition and making the change happen, and having and bringing all the actors and all the voices in that spirit and making them to help to bring this forward. So I think I would say, in jargon, that would say the governance of healthy cities and how can it come about? So I think that's really big. And to use the opportunities. So we need accountability mechanisms. Yes, digital will help, and that you may have more information around digital space that can increase the use, for example, of mobile air pollution monitors are useful to make people to understand what is the pollution, where they are, what are the potential sources perhaps, and to be engaged in the response. So the voices are important, the engagement mechanisms are important. I do agree certainly with health impact assessment being one of the ways that we can help create that understanding of what are the costs of inaction, what are the benefits of taking action that takes health into account. So I think all those are elements that build up the idea, that build up the messages, and that take people or different sectors into account or bring them into account. And for me, that's mostly what's missing. A transportation sector can go about doing anything they want and not being taken into account by a city necessarily in terms of the health impacts. I mean, I use transportation because that's the one we have made more progress. And Latin America, for example, has been notorious, Bogota included, in developing rapid bus transit systems and cycling lanes and pedestrian areas, etc. So I think there's sectors which have moved, but many sectors which haven't. So I would say voice accountability mechanisms, which include some scientific stuff like those using health impact assessments or in action research or in participatory research or transboundary research. But also, I think the other part is how do we then use that information in a context which allows actions to be taken, which empowers people to put pressure, and which really makes those issues resonate. So I think it's very interesting, it's fascinating, it's not necessarily easy. It's a very good opportunity, and that's what Society of Urban Health does. It brings together actors in urban planning and actors in public health and placemaking, etc., to have conversations, to do some action research. But I think moving forward, looking at the governance mechanism, what's in everyday's ways of operating of a city that can allow for different people to listen and to hear what's happening to health, what it could be different. Is not only to know what is good for health, is to create mechanisms to be able to listen, to understand, and to move.
Thank you, Carlos.
Very
And
good
you've
stuff.
Thank you. Thank you. And you've mentioned some good ideas about how to improve urban health already. Priya, what are challenges that you've encountered, and what do you think could be low-hanging fruit for improving urban health?
Thanks. I completely agree with both Carlos and Jill. Urban is complex. Coming from a low-middle income setting where I've spent most of my childhood in cities and the vagaries of political governance, my inclination is to work with what we have and within what we have rather than attempt to change the system. Urban is very complex. It's deeply political. It's also an engine. Cities are cities of dreams. There are books. There are 6 books and counting written on the city of Mumbai alone, 4 about Beijing and 3 about China, Shanghai. Please do read Tashaw's 5-Star Billionaire. It's a fabulous account of Shanghai's growth. So to me, the low-hanging fruit is to really capitalize on what's happening now in cities with the pandemic, with these changes. And 3 things come to mind. One is to leverage the power of partnerships. Cities are about different stakeholders. And yet, when you're planning a city, the people living in those cities are not always consulted around many things. Land is one of the most precious things in cities. Believe it or not, in 2022, India's real estate sector saw over 1,700 acres of land deals in the top 8 cities in India alone, and this was during COVID. So land commodity is going to become increasingly precious in cities. And without land and without space, it's going to, impinge on every other outcome. How you think, your mental health, whether you can afford housing, whether you can have your dream workplace, all that is up in the air. And I think part of that is to begin to leverage on sectors that are impinging on land. So part of this is to try and work with the private sector to impose regulations, if possible, on the private sector to get them to work on better land use. Singapore has an interesting example. They have something called the long-term review plan, where this year they consulted around 5,000 people from across society, These included students, it included the private sector, it included nonprofits. And the end of this plan was an interesting experiment that they did in an area in Singapore called Tanjong Pagar with a very well-known developer. And what they had him do was, with every hectare of land that he was developing, he had to work with the local community to create a green space that was open to communities beyond those who were buying into his particular private holding. It's an interesting experiment, and it's working and currently being evaluated. Things like this would greatly benefit overpopulated cities in many ways. The second is how we view health outcomes in urban spaces. And this is a conversation I've been having with friends and colleagues in the sidelines of this event. And I know there are a lot of you who are working in the NCD space, a lot of you working in infectious disease. But I think urban is one area where NCDs and infectious diseases have to come together. Each one is correlated, and we cannot work on this in silos. So when we approach diseases from a whole of society approach, we can create continuums of care within urban systems that have long-term implications rather than short-term ones. Medical treatment of diseases is just 1/4 of health. The rest of health is how you live, where you live. Can you chase your dreams? Are you sleeping a good night's sleep? Are you getting stressed? And your built environment has so much to say on that. So these are some of the low-hanging fruits I would capitalize on. That, of course, and my favorite, which is digital transformation and how that really interfaces with health systems, but that's about new types of partnerships. I'll bring that up later down in the conversation.
Great, thanks. And Jill, you said earlier you worked in 350 cities, and probably you're counting still. What are low-hanging fruit, or even like deeper and more complex measures that will be needed to fundamentally shift urban health?
Well, I think that we need to realize that it's not complex. We know what needs to be done. The healthiest people in the world live in cities, and the unhealthiest people in the world also live in cities. When you go to the wealthy neighborhoods of the cities, even when you fly over cities, you know exactly where the wealthy people live, because there are trees and there are parks and there's a lot of green areas. In the low-income areas, there is none of that. No trees, no parks, no green. And when you go down to the floor, at the floor level, in the wealthy areas, you have sidewalks and crosswalks and trails and bike lanes. In the low-income areas, you don't. So we know what needs to be done. It's not rocket science. We need to do it. There has been, and by the way, the population is going to grow not only in the global south. I live in Toronto, in Canada. All of the large and medium-sized cities are going to increase by over 50% the population in the next 30 years. In the US, it's going to need about 50 million homes in the next 40 years. Unfortunately, we are not doing it right. Incredible. The countries with the highest wealth and education and so on, we are continuing to sprawl. For example, low-hanging fruits, all of the population growth should be in the existing footprint. We cannot continue to grow and expand, because we will not be able to bring water and sewage and work and public transit. So that has to be. So also, I think that what if every decision in cities, like Carsten proposing his plan, was bound by urban health? What is the impact on socializing, on nature, and on the built environment and the interrelation of those? What if everything that we did in our cities, the sidewalks, the crosswalks, the mobility, was about that? Also, we need to realize that there is no health system in the world that will be good enough if it's only curative. We have not paid enough attention for promotion. And promotion is not only about education, it's also about infrastructure, it's also about programs, it's also about leading by example. So I think that the leaders can play a huge role on this. So I think that Of course, there are some issues of legal, like how we label food, where do we put it, but there's a lot of food deserts we need to change. I think the key message is that the problem about having healthy urban areas is not technical. We know how to what needs to be done. Also, it's not financial, because some cities say, "Oh, we don't have money," and you see that they are building highways, widening roads, flyovers. So the money is there, but they are using it in other modes. It is political. It is about policy. For example, we need to walk and bike. We need to be physically active. Anyone, anywhere in the world says the most important, like the magic pill for health, is physical activity. Physical activity. The only way that, but it has to be 5 or more days a week. The only way that people are going to be physically active 5 or more days a week for 30 minutes is if people walk or bike as a normal part of everyday life. I mean, people might play football once a week. People might play tennis twice a week. But if we needed 5 or more days, so we need to have sidewalks. We need to have protected bike lanes, networks. Actually, sidewalks is probably the most important infrastructure in any city. And when I visit cities, almost the level of how civilized or not the city is by how good are their sidewalks. Because, by the way, sidewalks is where you develop that sense of belonging. It's not just to go from point A to point B. It's where people socialize, where people meet their neighbors, the people selling flowers and fruits and so on. So I would say my key message is that we need to move from talking to doing. And we need to develop more of a sense of urgency, and that to realize that it's not only an opportunity, but we need to develop a huge sense of responsibility, because whether we like it or not, we're going to double the urban population in the next 40 years. And we can do it right if we do things radically different, or we can continue doing more of the same, and that would be tragic.
Great, thank you so much. And Carlos, when you look at this from a slightly different perspective, we also have, of course, a lot of academics in the hub. What research or knowledge gaps currently exist with regard to healthy cities? Where do you think that there are gaps that might need to be filled?
Thank you. I think there's a great advantage that we have academics in the room, and that we have academics in many large cities or sometimes medium cities. And I think one of the things that has to happen in terms of research is cross-cutting research among people who are at university in that city, the local authority, the civil society organizations, around issues which are important for that one city. This is one of the things that I think should be happening much more, rather than doing research which is focused elsewhere. So I think there's an opportunity lying there of enhancing research connections around local issues involving the local actors, including the university. So that's the first point. In terms of what research gaps, what areas, we did an exercise, the society did an exercise for the WHO around what was missing in terms of urban health. And what is missing, the first issue was climate change. And why? It's not that there's a lack of research on climate change. What there's a lack of research on is in the connection between climate change and health. But again, as we've been talking here, is not what are the links. We know what the links are, but what can be done and where, and what change does it make, and what are the mechanisms for change. So for that purpose, I think is action research, some qualitative research, as well as other kinds of indicators. I'm an epidemiologist, I love numbers, but we need stories. We need to know about what happened somewhere or in a different place, as well as we need a good set of indicators. And in climate change specifically, you have it's a huge opportunity for urban health. There's immense amount of resources which are going to both adaptation and mitigation. And although that's happening, the connections with health are still not very clear. If you just look at the national adaptation plans or mitigation plans or the Green Climate Fund. There's a big gap in terms of what's going clearly into the health connections and looking at the results, what the expected results, and what really happened in reality, and the mechanisms for adapting and mitigating to climate change in ways that enhance public health, to parks, to sustainable transport, to cycling and walking, to healthy food access. But having that measure or in the documentation of what are the health benefits is missing, in my view. Also, I think the health systems are not yet connecting completely to, although primary health care is about public participation, is about cross-sectoral action. I think that how to do that, still we have some steps to go. So that's very fruitful area for research. And the last point that I'll make is what we're stressing in the society is to involve people locally in actual research, because it's no use to have research being done just on certain parts of the world. It's necessary that local issues and local actors are brought together into research.
Yeah, right. Thank you. Jill, you said you just said the knowledge is there. We just need to make it happen. Of course, it's not easy, but what are the roles of the different stakeholders in advancing healthy cities? Jill,
I think
can
you
hear?
mute.
Oh. Jill, can you hear us?
Yes. Oh, you asked me?
Yes, sorry.
Oh,
Do you want me to
sorry.
repeat the question?
Yeah, please.
Okay, sure. So you said earlier that the knowledge, which in the knowledge gaps and the which Carlos just mentioned, you said the knowledge is actually there, but we need to make healthy cities happen. So can you share what stakeholders need to be involved? This is also something Carlos emphasized, and what their roles are in actually advancing healthy cities.
Yeah, sorry, I thought you were asking Priya. No, I think that we know what needs to be done. I think that is not rocket science. I think the academics can play a magnificent role because the academics are there for many, many years. But they need to get out of their desk, out of the laboratory. They need to work with the cities. They need to be interwoven. The academics can help work on the what needs to be done. The what should not be political. For example, the what about planting trees, about having tree equity. That should not be maybe the how can be political. Maybe the political parties from the left want to plant trees with unionized workers. The ones on the right want to do it with outsourced to private sector. But that is the how, not the what. So I think that the academics can help on the what. Also, people always have an excuse that somewhere else it's easy. No, it's never easy. It's always hard. Some people, oh, it's because they have money. Oh, it's because the mayor has power. No, it's always hard. But that's why we need people to do it. If it was easy, it would already be done. But we need to realize, don't accept no for an answer. We need to find that little crack through the window and run for it. We need to find solutions to the problems, not problems to the solutions. So I think that we really need to have a focus on doers. We need to have more advocates. We need to have passionate advocates in the city, people that are advocating for safe walk to school and bike to school. For example, people always have the excuse of the weather. Oh, it's too cold or it's too hot. Well, I've been working in Norway in places where in winter at minus 30 degrees, 80% of the children bike to school. It's not the weather is more of a mental issue. That, like they said, there is no such thing as bad weather. It's bad clothing. So we really need to change how we live. We need to realize that the way we've been building cities are not good for mental health or physical change. I mean, climate change is about how we live. But most countries are still buying more cars, more roads, bigger houses, more. If we don't change, climate change is going to completely destroy us. So I do think that in that sense, so we need everything. We need the private sector, the public sector, the not-for-profit, everybody working together. But so for that, we need a shared vision. How do we want to live? When we have a clear shared vision, then it doesn't matter which pieces of the puzzle we do. That is like an image of a puzzle. It doesn't matter which pieces, as long as are pieces of the same puzzle. So it's not just about action. No, we need the action, but around a shared vision, and it is doable.
Great, thanks. Carsten, you would like to say something?
I think it's clear why we invited Jill here. I think you always make wonderful this case, and that there are hardly any excuses. But there's one point which I would also like to raise, and which I think makes it difficult, and it actually refers to what all of you said. There are a lot of solutions out there, and in all of the countries that are seeing a lot of urbanization at the moment, be it Sub-Saharan Africa, be it South Asia, we have very good planners who know what a healthy city would look like. But we have the problem, and we haven't addressed that, and this is something I would really like to put in our discussion of the last 20 minutes, is the issue of informality. And informality is something which actually hinders us implementing these things. I totally agree with you, it shouldn't be an excuse, but maybe this is something I would also like our three guests to say something about, because informality is on the one hand what the peoples do, the structures which they bring, which can sometimes, and we discussed this also over lunch, can also be benefiting. For example, in Dharavi, they organized a very interesting reaction to COVID-19. It was a spontaneous social network which emerged, which actually locally tackled, without any help from the government, the pandemic. So we have informality as a reality, and we can't say that informality will go away. That was a discussion that was there in the 90s, where they said, okay, informality is something which will be there for some time, and then in the future this will all be formalized. But that doesn't work, and I think the urbanization that we see at the moment is highly characterized by informality, and that actually is a problem for implementing the good things that we know. So maybe a question would be, how do we deal with informality, and how can we leverage informality?
Right, thanks, Carsten. Priya, would you like to comment on that?
That's a really big question, Carsten. I'm not sure I have all the answers, but one way to kind of approach, I think many cities are beginning to approach informalities is to learn through their mistakes. And that's exactly it. I think initially there were movements within cities to move people away from crowded spaces so that people would have footpaths to walk on. So vendors were moved away. Small shops were moved away from enclaves because, it was getting too messy. But then when you move them away, you had an entire community that serviced a particular neighborhood. So informality has to be woven into how we see cities. And that I go back to my first comment that every city has a DNA. It's what makes it special. And we have to design and plan with these informalities in mind. We cannot wish them away, but we can definitely create more working structures around these informal settlements. Maybe intelligent design that looks at better water or sanitation to these particular communities, allowing them to flourish where they are, but at the same time giving them certain benefits that come from being part of a mega city. I think there are lots of solutions. Cities are spaces of great intelligence. They are hugely organic. They are, very agile. And so, it goes back to some of the arguments that were made. Stakeholders, using those people who live in informal settlements as stakeholders, incorporating them in some of your designs and getting that feedback loop. And I think in a post-COVID world, there's going to be more of that happening. Case in point, when Chennai went through this massive flooding in 2015, it was like the deluge of the Noah's Ark, and the entire airport submerged because, well, in their wisdom, the Airports Authority of India decided to build the airport on a mangrove forest, which was actually several centimeters, which was a natural water agglomeration body. And then, so now, 10 years down the line, well, it's been rather slow, but they are realizing. And part of that is to really understand the communities that live around the airport area. the displaced communities, and kind of weaving them into the urban fabric. And that's what we need. I don't think any city is going to be, every city will have its own charms. No city is going to be spotlessly clean, or you can't imagine. It's like, apples and oranges, but every city has its own heartbeat. And if informality is part of that heartbeat, we should celebrate it.
Great, thank you. And then what is according to you, Carlos, what is the potential of the nexus between urban transformation and global health? What do you really see is going to come out if we get it right?
Just complete with the informality. I'm Brazilian, and there's some of the best examples of empowerment are in informal sectors. Like there's a lot of work on legal empowerment and capacity building and people being trained to understand what their rights are, be in terms of gender issues, or be in terms of occupation of space, etc. So I think I agree with what Priya is saying, is celebrating, but it's also hearing where they are and what are the things which are mostly pressing for different populations, and what are the solutions. There's some very good research in Bahia, in the north of Brazil, the northeast, in how you can build structures for water and sanitation, which also create some public space, etc. So it's well documented, a cost-benefit analysis, etc. So I think that's one of the. I'm deviating from your question in terms of structural change, but I think the knowledge and the actors and the voices are part of the structural change which are necessary, and the vehicles for that. So that's first. The other part, which I think perhaps is the elephant in the room, is the health system, because if you look at primary health care and the history of primary health care and universal health coverage, they all mention cross-sectoral policies, assessing drivers of health, social and environmental determinants, etc. But still, a lot of the investments in the primary health care structure are mostly geared to the response, to the healthcare part, etc. So I think finding out the finance, and I know you heard to Mariana Mazzucato yesterday in the session. I mean, being able to put money where the value is, which is one point that she makes well, and where are the public goods, being able to make visible the externalities, have mechanisms to internalize those externalities for whoever is creating them. Those are structural points, and those are amenable to governance and amenable to law, to information systems, to accountability mechanisms. And I think we're still sitting, although we know the importance of this cross connections across sectors, I think we're still very busy, each one with their own sector. So whoever is going to do, that sort of is not only the vision is very important. I agree with Jill, but then what are the mechanisms to make that common aspirations possible, to bring those together? Those are structural issues. And I think both the health sector, or climate people who are doing the transformations for climate, or those visions, there's more engineering on one side, more physics in the other, there's more healthcare in the other side. I think there's some space there for more connectivity. There's both an issue for action research, but also an issue for experimentation. And nowhere better than a city, small or large, to experiment, to innovate, and to investigate. So I'll go back to my earlier point that what we would really like to see in the society, myself personally, is more of that connected activity at the local level, finding out how is that a health system can engage more and more realistically in cross-sectoral action. I mean, people have been trained, there's a lot of indicators, but how is it that you do it? That's a matter for urgent focus and action, I'd say.
Thanks, Carlos. And Jill, what do you see as the potential for the nexus between urban transformation and global health? What happens if we get it right?
Oh, if we get it right, it would be magnificent because we would have people living older, healthier, happier. And it's doable. Look, for example, during COVID, at one point, they said, oh, you need to lock down, you need to stay home. And in just a few days, whether it was Delhi or Milano, Italy, or in North America, anywhere, before that, you couldn't even see some buildings and you couldn't even see some mountains. And they kept telling you that the quality of air was bad, but you never really actually saw it. But when we put cars away for a few days, all of a sudden the air was clean and we could see those buildings and those mountains. So it was like if God had sent us a message. You want to have clean air? This is how you do it. By the way, every single year, over 700,000 children die because of bad quality of air. Over 4 million get bad lungs for life because of bad quality of air. So we know the impact. So we need to do it. Also, for example, you were talking about the informal settlements. I need to make something in the slums. People are living like animals. So we need to be very, very careful to say, oh, they're so cute, they talk to each other and they do parties. No, we need to work with them. I mean, urban health, we said it was about socializing and it was about nature and it was about the built environment. So we need to work with the people that live in the slums to do something better. But they don't have clean water, they don't have sewage, they don't have schools or libraries or sidewalks or work or mobility or nothing. Nothing. We should be ashamed of ourselves that in the same cities where people are living almost like animals, some people are living like the healthiest in urban health. So I think we need to work with the people that live in the slums, but we need to do, for example, in Bogota, when one of my brothers was mayor, he built over 50 schools, fantastic, in the lowest income, in the extreme poverty areas. And actually, he outsourced the management to 75% of them with the best schools, private schools in the country. So they were in the lowest income, they were totally free, but the infrastructure was as good as any private school. So that is about changing. I think that we cannot give everybody a home in the very short term, but we can give everybody fantastic public, everything that is public. We need to build parks and trees and sidewalks and schools. For example, if they don't have a park, we need to turn down some of those houses, buy them, rebuild them in the same area, and create the space where they can actually do activities, because that is going to create safer communities and healthier and happier. So I do think that we need to work on that, the socializing, but also on nature and the built environment. And we have all of the know-how to improve those. It's not just tearing it apart and sending them 2 hours away. No, that is so cruel. That is not. It's how to keep the community within themselves, but with dignity as human beings. And we need to work on that, but also we need to do it fast. We need to, because sometimes, with all respect to academics, sometimes we see people that go to these slums and they say, oh, how cute, and they are nice and they chat, and at night some of them dance. Yeah, but look at the quality of how they live, where their food deserts, and their children are totally unsafe. Most children don't even know who their father is. It's really, really tragic. So I do think that should be our top priority. Our top priority, as we double the population living in urban areas, should be the most vulnerable citizens. The most vulnerable by age are the small children and the very old, but also everyone that is poor. For example, one last thing. We know that the first 4 years of the life, those 48 months, are the most critical. If children, those 4 months, 4 years, those 4 years, 48 months will impact the potential for that person for the next 86 years if they're going to live to 90. So the nutrition, the love, the affection, the contact with green spaces, the physical activity. But nevertheless, in most countries, those 4 years for most children are very, very difficult. So, I mean, that should be a top priority because those children are going to be handicapped for life. And something that is bad, even worse, is that it's a handicap that is not visible. But in those 4 years is when the brain is forming, the muscles, the bones, the structures, the sociability. So we really need to make that a top priority. So in other words, if we do it right, I think that, and we have done a lot of things right. I mean, a lot of the mortality of children has gone down almost on everything. Clean water, I mean, just 40 years ago, only 1 billion people have clean water. Now more than 7 billion have clean water. I mean, we have improved in many, many areas. Extreme poverty. We used to have 80% of the population in extreme poverty. Now it's less than 8%, and eventually it's going to be zero. I mean, so we have a lot of accomplishments, but we also need to realize that also we need have some big challenges.
Right. Thank you so much, Jill, for making this inequity so tangible. And I think we all subscribe to the vision you outlined in the beginning. We as a German community are, of course, also really interested in what Germany's role could be in actually promoting healthy cities in low and middle income countries. Priya, do you have any advice for us?
Well, I think, just listening to the course of the conversations over the last 2 days, I think a couple of things come to mind. One is the deep interest in climate change and the worry for the future of Germany's own cities and its impact on the world. The deep understanding of growing inequities that are happening in cities. And I think, it does seem to me, another panelist actually said that tomorrow was going to be Heat Action Day, and an entire community was going to get together to really talk about the implications of the growing heat wave, which is impacting many cities. So I think Germany's role could essentially be a catalyst to begin these discussions at a deeper level with other cities in the global south. And I think it's time for a two-way exchange. I think cities need to learn from each other. I don't think you can replicate what you're doing because the contexts are so different. But what you can do is to catalyze thinking. And I'd like to go back to what Carlos said, that cities are great crucibles for experimentation. You can get away with an experiment as a living experiment for public good. So whether that experiment is to hold a land mafia to account, which is what needs to be done in a majority of Indian cities, it's a political nexus, whether it is about better water and sanitation in India's informal settlements and urban slums, or Manila's urban slums, or whether it is to understand better urban governance, more innovative, more creative urban governance, to really try and understand how other cities are applying certain frameworks and tools to understand things like environmental health, changes in a city's environment. I think these are wonderful ways to catalyze thought and new types of thinking around urban health, which is desperately needed. I don't think we can go back to the same old formula of pre-COVID days. And I don't think urban governance is still forward-thinking enough to start rethinking or reimagining the way cities should be. And I think that's a great start for a country like Germany to really begin some of those catalytic conversations and really create a body of space and evidence where cities can actually learn by doing.
Great, thank you. That was beautifully said, and I'm sure Carsten will take a lot of these thoughts into the Hub community. But before Carsten maybe shares a bit more on the plans of the community moving forward, I would like to engage our online audience who has been patiently waiting to get some of their questions addressed. Thanks a lot for that. I would like to ask the panel if you can share your perspectives on addressing gentrification or the fear of gentrification within communities when focusing on urban transformation in cities. Who would like to? Carlos, would you like to start?
Well, okay.
Jill, you would like to start.
Well, yeah, one, and also with your previous question on the role of Germany. I think that Germany could play a magnificent role, not only because you have money, but because you have credibility. And I think that especially in the emerging countries, having the credibility of Germany is very, very important. So I think that whatever you say, people pay attention. So I think that is one thing. Second, whenever you're going to support projects or give funding, don't try to replace the government. Use it for innovative things, for things that are difficult, for things that the government is not willing to put money because it politically might be controversial. So if you can fund innovative, bold pilots, new ideas, I think that would really be good. Not things that the government is already doing. Don't give it more money for that, but do something that is hard, that is difficult, but that you are well aware. And third, I think that you could really provide a lot of support to develop teams and capacity building to the decision makers. Because, of course, we all want bottom up and all of this, but the reality is that if you can open up their minds of the decision makers, of the mayors and their teams, you could develop some short seminars or whatever, but with the decision makers at the very highest level. I think that could really be transformational, and I think that Germany could help in all of those issues. As far as gentrification, the only way to avoid gentrification is for the government to intervene. And if there are social housing, for example, that is owned or funded by the government or non-profits, then when you improve those areas, there will not be gentrification. But if it's private sector, we cannot continue to treat, like Priya was talking about, the mafias of the land. No, we need to take over those lands. We need to learn from many cities in Europe, like all of the cities in Sweden, that all of the land around the cities is public sector. They belong to them. There has to be some kind of control, because if not, gentrification is going to continue to happen. So we need a very strong role of governments in order to keep to avoid gentrification.
Thanks, Jill. And if there are any further questions from the audience, then we can take one or two. Yes, please.
Okay, hi everyone. I'm Melvin Otieno from Kenya. I've really enjoyed this discussion today. So I just realized that there was no focus on the youth. So I was wondering, now that especially in sub-Saharan Africa, a high percentage are the youths. So how can we determine the meaningful engagement of the youth, and how can we assure it is properly implemented in policy and practice? Because there's a lot of window of opportunities of engaging the youths. Because now that I work closely with the Planetary Health Alliance and also supporting the Planetary Health Eastern African Hub, we usually have the Campus Ambassador Program. And this is a youth-led initiative whereby students are engaging in activities. And in Kenya, for instance, we had several students who wanted to focus on urban activities, but there is no support. So, because we have also opportunities whereby they could do case study and sort of determine which urban areas they could study about, maybe compare in Kenya, urban areas in Kenya and maybe in Germany and so on. So we've been having like summer school programs that they are able to learn. Like last year, we had students from Kenya going to Wurzburg and learning a lot of how Wurzburg has been trying to manage its urban area. So in your own opinion, what would you like to determine the meaningful engagement of the youth? Thanks.
Jill, would you like to take this question? Very briefly, please, if possible.
Okay. Well, I think that I love Kenya, and And you know, one of the things that I love about Kenya is that it has the best marathon runners in the world. Why? Because they have discipline, they train, they program, they plan. So my question is, if you can be the best in the world in marathons, why is it that you cannot be the best in the world in urban health? Why is it that you cannot have, for example, protected bike lanes as good or better than Copenhagen? It's not about money. For example, I saw in Nairobi, working in Nairobi, I saw some big avenues for 6 lanes and 8 lanes for cars with no sidewalks, no bike lanes. So we need to engage the young people and say, look, it does not have to happen like this. We need to build cities for people. We need to give top priority, and we need to listen to the young people. And we need to also, that is something where the Germans could help, is providing funding for youth groups, for advocates, people that are advocating on climate change or are advocating on sustainable mobility, people for advocating on urban health. And just the same way that emerging countries can compete on having the best wine or best fruits or best marathon runners, they also can compete in being the cities with the best urban health. And the young people are critical, because within the lifetime of the young people in Kenya, the urban population is going to double within their lifetime. So they can do it radically different and better and equitable, and they cannot continue doing more of the same. And also, one last comment is, countries with money need to respect the locals. For example, through Nairobi, they are building an elevated highway funded by China. Horrible. They're splitting the city of Nairobi in two, really horrible, when they should have invested that money in public transit. From the point of view of climate change, that is a horror. So the youth, let's empower youth to have a very loud voice.
Thanks, Jill. I think we had a lot of passion from you. There's a lot of passion in the chat and also in the questions, but we have to unfortunately come to a close because Carsten, he has to catch his train, and I think we're running over time. So, but we would love to discuss, to continue these discussions with you in the Hub community on global urban health. And Carsten, maybe you can just share some very brief comment with us on what the global urban health community is planning to do within the next couple of months.
Yeah, I have a very high interest in this being brief. So what we want to do is actually, we would like to also engage with the other panelists and the Global Urban Health Hub community on urban health, and start a series of webinars where we actually identify good examples, good practice examples. And our idea is to actually have countries or bring together stakeholders from the same contexts. I think, Jill, you're right. There are good examples which can be copied, but maybe for the mayor of Mumbai, Copenhagen is not really the best thing. Maybe for him it would be more interesting to see good implementation case studies from countries where the context is more similar. And I think identifying these good practice examples is something we could initiate. And the second thing goes a little bit back to our recommendations for the policy brief. We actually would like to work a little bit towards this city diagnosis. So we would really like to provide, and there are a lot of tools out there, but we would like to compile them, bring them together, and have a kind of information hub. So if urban planners actually want to understand what are their main priorities for improving urban health, what are the tools they can use, what are the questions they can ask, who are the stakeholders they can engage with. So provide them a kind of toolkit out of the existing literature. And Carlos, you said it, it's not rocket science, and there's been a lot of research, maybe not specifically for the Global South. I think this is a little bit of a blind spot when we see the research on urban health. This is focused a lot on United States, UK, Canada. But I think there's a lot of things there we can collect and adapt. So these are basically the two things: the toolbox for the urban diagnosis, and the webinar for collecting good examples and initiating a dialogue.
That sounds great, and we at the Hub will be very happy to support your next steps as usual. If you want to become a member of the Global Urban Health Community or any other community, then do write to us, and thank you very much for listening and being with us on this panel.